Welcome to the Johns Hopkins Women's Health Podcast, A Woman's Journey, Insights That Matter. I'm Kelly Gear-Ripken, and I invite you to listen to Johns Hopkins specialists discuss the latest topics in women's health. Now here's your host, Lily Shockney.
Hi, this is Lily Shockney from A Woman's Journey at Johns Hopkins, and this is our podcast, Insights That Matter. Kidney disease is a serious disease affecting more than 30 million Americans who have less severe types of kidney disease, and more than 700,000 have End Stage Renal Disease, known as ESRD. My guest today is Dr. Deidra Crews, a nephrologist and epidemiologist here at Johns Hopkins. Welcome, Deidra, to our podcast today.
Thank you.
Can you give us some background on the kidney as an organ itself and what it does?
Sure. So the kidney is a very important organ. Most people are born with two of them, and they perform a number of different functions, including managing the fluid and electrolyte balance for the body, as well as maintaining certain minerals of the body in a normal sort of balance. So things like potassium, calcium, and other minerals. The kidney also does perform some functions that help us to maintain a normal blood count. It participates in creating a hormone or chemical that helps stimulate production of blood cells. And the kidney has a major role in helping us to maintain a normal blood pressure through its work with regard to the fluid balance for the body. That has a big impact on keeping our blood pressure where it needs to be.
And I think oftentimes people just think of the kidney as being a sister to the bladder and just has a role with our urinary tract and doesn't really understand the significance of kidney function and the importance of our kidneys working well. I remember when I was in nursing school more than 45 years ago now, and each of our professors were physicians, and each one would come in, so the cardiologist would come in and say, the heart's the most important organ, and you'd hear his talk, and then the brain is the most important organ, and you hear his talk. And when the nephrologist came in, he says, listen, I know you've been told how important everything else is. I'm going to tell you, you better pay attention to your patient's kidneys. And I have never forgotten that. I even remember the man's name. So we should appreciate and pay attention to our kidneys, making sure that they are functioning well and understanding a bit more about who may be at risk for kidney disease. So who is at risk for kidney disease?
Great. So anyone can develop kidney disease. I think that's an important thing to know, but there are certain people who are at higher risk of developing kidney disease, and those are going to include people who have a family history of chronic kidney disease. Kidney disease also is more common as we get older, so older adults are more affected by kidney disease. And then also there are certain racial and ethnic groups who have higher risks for developing kidney disease, including Blacks or African Americans, Hispanics, and Native Americans who do have greater risk, including that African Americans are at up to 4 times the risk of developing end-stage kidney disease or end-stage renal disease when compared to whites. And so there's great disparity there. People who have low incomes or who are of sort of low socioeconomic status also are at greater risk. And we don't fully understand all the factors that are at play there, but some of that certainly has to do with access to health care, a number of the different stressors that are related to living with low incomes, and access to other things that help to promote a healthy lifestyle seem to play a role there as well.
So I've read that Blacks in Baltimore have a 3 times higher risk than the rest of the country. Why do you think that is?
I think that, and this is not something that we fully understand, and it's an active area of my research and that of others. But when we look at some of the other factors, as I mentioned, income status, right, and we think about how historically a number of different populations in the United States have not had as much economic opportunity as others, including African Americans in Baltimore, then I think it becomes clear that there could be additional factors that are at play there that may make that risk even more magnified. And I think that's part of why we see what we see.
So how is kidney disease treated?
There are a number of different ways that we treat kidney disease, and I should say that they focus a lot on thinking about the 2 major causes of kidney disease, and those being diabetes as well as hypertension. And so when we think about clinical risk factors. We focused a lot on kind of risk factors with respect to, age and racial and ethnic background and family history, but there's some clinical risk factors that include diabetes and hypertension. And so a lot of our focus when we're trying to treat chronic kidney disease and trying to keep it from progressing to where a person will need treatment such as a kidney transplant or kidney dialysis is really focused around management of those chronic conditions that are the main drivers of that person developing kidney disease. So including getting good control of their diabetes if they have that, as well as getting good control of their blood pressure if they have high blood pressure. So those two conditions make up 70% of the cases of chronic kidney disease, at least in the United States. But then, of course, there are another 3 in 10 or another 30% of people who have kidney disease from other conditions. And so they may require specific treatment for those. So things like certain autoimmune conditions such as lupus, for example. There's a type of kidney disease that can occur in people who have lupus. Certain infections can lead to kidney disease, including HIV infection. And so the specific treatments are going to vary depending on what the main cause was of the kidney disease.
What has been the success rate for African American women who have been using the DASH diet? And can you talk a little bit about the DASH diet?
Yeah, so one of the ways that when we think about really most people who have chronic kidney disease, one of the approaches that we try to take in the clinical setting is to try to help them make lifestyle changes in order to lessen the chances of their kidney disease progressing to end stage. And so one of the things that we focus on is the diet. And so the DASH diet, the dietary approaches to stop hypertension dietary pattern or kind of a way of eating, which is not a weight loss diet, but it is rather one that has been shown through a number of research studies to be able to allow a person to reduce their blood pressure when they're eating in this way. And then there's some newer evidence, some of which our team has been able to contribute to, suggesting that people who have early chronic kidney disease who are eating in such a way that is consistent with a DASH-like dietary pattern are actually less likely to see their kidney disease progress than those who do not eat in a DASH-like diet way. And so one of the, I think, exciting opportunities for African Americans more broadly and African American women even more specifically is that in the early studies related to the DASH diet, it was actually found that the DASH diet is actually more effective at lowering blood pressure among African Americans than it is among other racial and ethnic groups, such that when we think about things that we should be promoting and who we should be promoting them to, it makes a lot of sense that we should promote the DASH diet among African Americans who have hypertension, certainly, but also we're learning that it can even be effective for those who have early kidney disease.
And so name a couple foods that are the foundation for the DASH diet.
Sure. So the DASH dietary pattern is rich in fruits and vegetables, whole grains, low-fat dairy foods, and it contains kind of modest amounts of meats and limited amounts of things like desserts or sort of sugars. There is a version of the DASH diet that is low in sodium as well that's been tested in a number of different studies. And so when we're promoting that way of eating, there are a number of different approaches that can be used that are available online, that people can follow. Their apps that they can download on their phone to really help them to track how closely they're following a DASH-like diet. And again, it's not a weight loss diet, but it rather is one that can help to improve blood pressure, and we also believe it helps to protect the kidneys.
So we want them to dash in and get fruits and vegetables instead of dashing into the fast food places.
Sure. That would be a good place to start.
You've mentioned several times two of the most common causes of kidney disease, one being diabetes and the other being hypertension. I'd like you to talk a little bit more about diabetes. I would imagine that many of the individuals in our audience today are familiar with diabetes, but some of them are not going to be. And so let's talk a little bit more about that disorder.
So diabetes, I think simply stated, is a condition where the body is having difficulty managing its sugars and sort of controlling the use of sugars in the bloodstream. For some people, their body completely lacks the important chemical, the important hormone, which is insulin, to allow the processing and the use of sugars. Generally, that we're going to refer to that type of diabetes as type 1 diabetes. It more commonly occurs in younger people, although some people who are a little bit older can develop that type of diabetes. It is a rare form of diabetes compared to what we generally refer to as type 2 diabetes, which is the much more common form that tends to develop in adulthood, although we are now, particularly due to the epidemic we've seen around obesity and overweight in our country and indeed across the world, we're starting to see this type 2 diabetes even in children. And so in type 2 diabetes, there, in some cases, there's actually an abundance of insulin. There's lots of insulin around, but the tissues of the body are not able to effectively utilize that insulin in order to process the sugars that are in the body. And so a number of different approaches can be used there. For the type 1 diabetes patients, they certainly have to have insulin because their pancreas, which is the organ that makes insulin, the pancreas actually isn't making insulin, and so they need that to be supplemented. Whereas in type 2 diabetes, in some cases they do need insulin, but in many of the cases they are being treated with oral medications that actually helps to sensitize those tissues to the insulin that's already in their body, or it's helping to process those sugars. And so when it comes to kidney disease, the way that diabetes can ultimately end up causing kidney disease is that extra sugar floating around that's not being properly processed by the body actually can cause injury to the blood vessels of the body. And the kidney is comprised of really just these tiny little blood vessels that do all the types of work that I alluded to earlier.
All that heavy lifting.
The heavy lifting, and this excess sugar can cause damage to those tiny blood vessels, and ultimately, in some cases, can lead to the kidney to being leaky of important proteins in the body, and also can cause damage such that the kidney's ability to clear the blood of toxins and so forth is impaired. And so that's what we see with diabetes. And so around 40% of the cases of chronic kidney disease that we see in the U.S. are attributed to diabetes.
And how about hypertension? So high blood pressure, and I know that recently defining high blood pressure has changed.
So when we think about high blood pressure, I like to use a garden hose analogy. So if you think about using a garden hose, and if you're out in your yard and say you want to water some plants or the grass that's in your yard, and you're using a hose, and say that you let the water kind of run through naturally from the hose, and it sprinkles water on the plants, the flowers, and so forth, and they grow as when the sun shines, and they do quite well. But think about if you either put a knot in that hose, you sort of squeeze on it, then the water comes out of the hose, but it comes under pressure, and it will spray the flowers and the grass and could do damage to the petals of the flowers. And so that's the way I like to think about what hypertension or high blood pressure is doing to the blood vessels of the body. That squeeze ultimately means that the blood that's coming through those blood vessels are then hitting, if you will, the organs that blood is going to, which can include the brain and can include my favorite organ, the kidneys, and can do damage to those organs and can do damage over time. One of the things that I think is quite a challenge for those of us in healthcare who try to educate patients about the potential harms of hypertension is that it can in many cases not have any symptoms. And so for many people, because they don't feel any differently when their blood pressure is elevated, they think that there's not anything that needs to be done, whether that means that they may feel that they don't need to take certain medications that they may have been prescribed, or they may feel like they don't need to make specific lifestyle changes because they feel perfectly fine. But what happens over time, though, is that slowly the damage from the blood kind of flowing through the body under this pressure can lead to damage to organs, including to the kidney.
So you bring up a really important point, which is how do we manage chronic illnesses such as diabetes and hypertension? And most patients are on some type of medication that they are responsible to be taking every day, some oral therapy, and yet they don't take it every day because they don't feel sick. And we really do want to emphasize to our audience the importance of taking your medication as prescribed, that we hope that you aren't sick, That's actually maybe a sign that things are in your body are working pretty well. But without these drugs, things can get out of control, whether it be diabetes or also hypertension. And we don't want to see that happen, because then you're going to kind of hit that first domino that falls over in the row, and the next thing you know, you'll end up with kidney disease, and you may be seeing Deidra as a patient. So when someone is in kidney failure, what does that mean?
If you think about, again, some of those primary functions of the kidney, which include clearing the body of some of the toxins that the kidneys would normally be able to get rid of, that are just a natural part of the breakdown of, for example, the foods and the beverages that we take in each day, and just sort of our body's natural metabolism each day. The kidneys play a big role in that. And so, and as I mentioned, the kidneys also play a huge role in management of fluid and also minerals or electrolytes. And so in kidney failure, that generally means that the kidney's ability to clear those toxins is severely reduced. So we use a metric called the glomerular filtration rate to kind of look at
there's a word that might be on Jeopardy.
Yeah,
right?
It could be on Jeopardy. Or the GFR. And so the way that we're able to calculate that is using a test that most people have when they routinely will go in to have blood work done at their doctor's office. That test is the creatinine, which is a test that's done using the blood generally. And we can take the individual's creatinine and we can kind of estimate how good the kidneys are doing at clearing the body of these toxins that I mentioned. And so if a normal glomerular filtration rate is around 100, when it gets to be under 15, then we're at a pretty advanced level of chronic kidney disease, particularly if that's been going on for quite a while. And we start to wonder if this is a person who's going to ultimately go on to need either a kidney transplant in order to treat their kidney disease, or they may need kidney dialysis. And so I mentioned some of the ways that the kidneys can over time develop failure when we talked about diabetes and hypertension being the leading causes, and progressively that can happen, but also acute injuries to the kidney. So a person who is ill, even with some other conditions such as an infection, in the setting of severe dehydration, for example, the kidneys can get injured, and sometimes that can kind of push them over to hitting a place of having kidney failure. In some cases, you mentioned the kidney's relationship to the bladder. In some cases, the outflow, if you will, or the ability of that urine to go from the kidneys where the urine's made to the bladder where it's sort of stored, and then out of the body when we go to the restroom. Sometimes the ability of that urine to come out can get obstructed. So we think about some of the more common cases, including men who have prostate problems and having some difficulty with the urine being able to come out of the body in those cases. That can actually lead to kidney failure as well. And so there are a number of different ways. And when we see people who do develop kidney failure, again, the optimal treatment would be a kidney transplant. And that's what we certainly try to assess every person who develops kidney failure. We try to assess their eligibility for receiving a kidney transplant. And for those who are not eligible for a kidney transplant, then we would move on to thinking about kidney dialysis, or in some cases, people will elect to undergo just conservative management where they're not receiving either a transplant or dialysis.
When we're looking at leading causes of death in the U.S., talk a little bit about the differences with race, ethnicity, and even gender. What's happening for us women?
Interestingly, so in the United States, the leading causes is cardiovascular disease. So the including coronary heart disease, including in that also including stroke as well. Chronic kidney disease is the 9th leading cause of death in the United States. I think where it's important to think about women in this case is that when we think about cardiovascular disease, I think in decades past, it was thought that women didn't have quite the risk of developing cardiovascular disease that men had, but we now know that's not true. And in some cases, the risk is actually elevated among women. And so increased focus on women's cardiovascular health, and certainly with kidney health following close behind that, I think it is quite important. And there's a lot of both research work as well as advocacy work around getting that message out to women.
Can you give us 2 tips on how we can prevent kidney disease?
So the two tips that I would give with respect to kidney disease, the first one would be around lifestyle. And so while I talked quite a bit about people who already have early chronic kidney disease and ways that they can keep that from getting worse, thinking about things like following a DASH-like diet or just a general diet that is rich in fruits and vegetables, for example. We also have some evidence to suggest that even following that sort of way of eating, even for people who don't have kidney disease, may be able to help prevent them from developing it in the first place. So that would be the first thing that I would focus on. And then I would say the second thing is then getting monitored through close follow-up with your healthcare provider for people who may have some of these risk factors for kidney disease, to make sure that if it does develop, that it's caught early, and so that some of the medications, for example, that we know can be quite helpful in slowing the progression of kidney disease can be started earlier, and also control of some of these risk factors like diabetes and hypertension can be ensued earlier than what we might typically see.
You've given us a very good summary on kidney health, kidney disease, and what we can do to maintain our health, particularly our kidney health, far better than we probably have been. Something that I want to go back to is individuals that are in our underserved populations. And we know from some studies, and some of those studies have been done here at Hopkins, that their diet is more commonly higher in salt, higher in sugar. Part of it may be access to those fruits and vegetables, right? Access to healthier choices. But many of the people listening today are moms and grandmothers, and we really do need to pay attention to what our children are and are not doing. If we look at prior generations, they were outside playing, and youngsters today are inside using technology, which is only exercising their thumbs, unfortunately. So we need to get our kids to be more physically active so we can make sure that their weight stays where it belongs. Also getting their blood pumping, which I think also would be very helpful. Steering clear, with just maybe a few exceptions on occasion for a celebration, but steering clear of some of the more common foods eaten from fast food restaurants, which usually are high in calorie, high in fat, and high in salt, and high in sugar. If we don't teach our children the healthy lifestyles now, they certainly aren't going to learn them when they're away from us. We're programming them right now how they should be eating and how they should be exercising. So when you look at your children and your grandchildren, please do start now thinking about their kidney health. Thank you so much for joining us today, Deidra. This has been very informative.
Thank you.
Thank you for listening to A Woman's Journey podcast. Join me, Kelly Gear-Ripken, your host, Lily Shockney, and a variety of Johns Hopkins experts on the first Thursday of each month to learn about medical advances in women's health. A Woman's Journey is grateful for the unrestricted educational grants from Biosense Webster and Boston Scientific that support our podcast series, Insights That Matter. For more information about A Woman's Journey, visit our website, hopkinsmedicine.org/A Woman's Journey, and like us on Facebook and Twitter. Until next time, stay well.